We are lucky enough today to have Marie from EOS, who is the CEO and founder of the company. She'll be answering some questions around EOS and perhaps some clinical data that may help you better understand this imaging system, which is only one of two in Australia. Marie, can you explain what EOS is exactly and when you refer a patient to this new imaging system at the Valley Private Hospital?
EOS is an extremely innovative medical imaging technology that has been specifically designed for the imaging of the patient's skeleton and joints. The way it operates is in two steps. In the first step, the patient is getting 2 radiographs at extremely low dose of radiation. The dose is cut by about 85% with respect to other systems. Those 2 X-rays are taken frontally and laterally simultaneously. Those 2 images are then used to retrieve a 3D image of the patient's skeleton, which is the first time that the patient can be imaged in 3D and in a weight-bearing position, and which will be used by the orthopod or the general practitioner to better diagnose and understand the joint condition.
Why and when should we use EOS instead of other imaging systems such as X-ray, CT scan or MRI?
To be able to image in the best of ways joints such as the spine, the hip, the knee, and other joints of the body. The way it operates is extremely unique. It starts with taking a frontal and a lateral radiograph, X-ray, of the body, which can be done in the full body simultaneously and at a very low dose of radiation. This way the patient is exposed to 85% less radiation than with conventional radiography. After that step, the second step that EOS provides is the capacity from those 2 low-dose radiographs to retrieve a 3D image of the skeleton. And that's very unique because that 3D image of the skeleton is now available, thanks to EOS, in a weight-bearing position that respects the anatomy, the functional position of the joint, and which could not be obtained before.
Marie, the Stereos 3D modelling system is unique to EOS. Please explain from a clinical perspective the value of this for surgeons and other clinicians.
The way EOS is able, for the first time again, to provide 3D weight-bearing information is by a specific software in which some information from both the frontal view and the lateral view is seen as in the 2D radiograph. That 3D is a smart 3D in the sense that it allows, on one hand, the physician to have a 3D vision of the skeleton and the joint, of course, which is already a great help to understand the torsions that can take place in a deformative spine, in a hip joint, in a lower limb joint. But it also not only helps visualize, but also helps measure those torsions and what takes place and all in rotation, which was not available before, again, because you would take a flat image of a patient through a radiograph.
Marie, what do you see in the future for further applications and advancements for this amazing technology?
Today, EOS provides both 2D low dose, actually ultra low dose, and 3D information. What is now at work in EOS is the development of tools that will use that 3D into more help to the physician to be able to diagnose, but also to plan surgery such as hip replacement, total knee replacement, or even deformative spine surgeries, in which now the 3D information will be actually introduced into a planning strategy to better think ahead of the theater of surgery, what type of implant and what the position of that implant will be in the patient body.